And being good like Paul, I'm going to do exactly what Derek asked me to do today. And the first thing he asked me to do was to give you a short overview of where we are with health and well-being, which many of you will know. He said, could I find some numbers from somewhere? I've tried to do that. And then I'm going to try and say where I think the physical environment fits in. And for all of you in the audience, would you please start collecting data so that I can bring you some data to convince others, because much of what I'm going to say, if I'm honest, in that particular area is data free. I think the first thing to say, very importantly, is that we all are, thank goodness, living longer, but we're not necessarily living more healthily. So many of us will have more chronic conditions. The poorer we are, the more chronic conditions we will have. And so extending that working life is absolutely dependent on a certain level of mental and physical health. You cannot be in work if you are below a certain level. And yet we're at great risk of not having enough people healthy enough to work longer. And a lot of that, as you will know, is due to lifestyle factors. And I hate to say, much of it is driven by obesity. So that's important. We can't do this through one agency. I'm often asked, what's government doing, Carol? Well, they can do so much. I've put there the people I think are important to this agenda. I'm really going to talk today mainly about employers and employees, but please bear in mind that there are a whole host of other people that can absolutely help with this agenda. We should be talking to them all. And I think some of you will know that the government has announced its new Work and Health Unit, which brings together Department of Health, Department of Work and Pensions, but liaising with a lot of other government and non-government departments, and they put high on their list of people to engage with our employers. So for me, the sequence, and this is where you come in right at the top, you have to create good work, and that's really what Paul's been talking about. Partly this good work, saying thank you, doing simple things that don't cost a lot of money. But then how do you create good workplaces? Which is about how do you create a good office space? How do you stop people just sitting at their desks, eating their lunch at their desk, taking the tube to work, walking hardly anything at all, and many of them actually saying that they are putting weight on and they are really not enjoying good nutrition. How do you stop that? If you're going to get the top two in place, then employees will show well-being, contentment. Paul talked about happiness, but they're all along this spectrum. And I'm going to use the word resilience. It's a word I hear a lot more in this space now, and being resilient is important. I have to confess the trade unions don't like me using that word. They think it's about making people resilient to perhaps to do things when the employers, this workspace, should be correcting things that are causing people to need to be resilient. But we could argue that one. We do need our employers to be engaged, because if not, they won't give 100%. There'll be plenty of presenteeism around. Then you'll get increased productivity and economic growth. I really believe that once you start getting into a bad place with these things, workers will be unwell. Sickness absence is a very good thing to do if you wish to avoid the unhappy workplace and you don't like your line manager. It's a good thing. You can get a sick note. So from the employee's point of view, it's much better than having the GP write, which he never will, does not like line manager, needs time off work. They never, ever, to my knowledge, put that. So this is very important. As I said, Derek said, could I give you some numbers about the effect on the economy of sickness absence? Well, in my first report, and this is certainly out of date in 2008, we estimated, if you put everything together, the total effect was about 100 billion. Mental health is ever increasing, and this relates to what Paul said, stress, anxiety, depression. These are mild mental health problems. They're not diseases. It's not like schizophrenia or bipolar. We ought to be able to deal with them. We ought to deal with them early and effectively and quickly. We should not let them continue. And we often shove it under the carpet because mental health is difficult to talk about, but that's where a lot of what Paul says comes into place. And you will know that the public sector are more likely to have days off due to sickness absence than those in the private sector. That is a worry to the public sector, and there are different bits of the public sector that are now trying to do something about this. So, commonest reason that we don't go to work, and not that we have cancer or uncontrolled diabetes. They're the more easy things to handle. They're not usually so difficult for an employer. They're reality. Things have to happen to help you control these things or get better from them. But you know, stress is a problem. You can't deny somebody's got stress. It's not diagnosable by any nice blood test or any investigation. Back pain isn't. You can do all the blood tests you like. You can x-ray the spine. All may come back normal. Somebody says, I've got back pain. They've got back pain. But in fact, in a very good, well-controlled study by some Scandinavian researchers, if you look at the predictors of back pain, it's not whether you've got a slipped disc, been cleaning the car, doing too much gardening. The predictors of back pain is, do you have any control at work? Is there fair leadership in your organisation? And is there empowering leadership? So don't just order the 10 courses of physiotherapy. You will waste money. You will not solve your problems if you don't ask the correct question, which is, what is the barrier to you being in the workplace? Not what have you got, because they'll say back pain. The real question is, what is the barrier to you not coming to work? And when you ask that question, you might get some very, very unusual and perhaps difficult responses. The quality of the workplace, and I purposely put the physical environment there, and you will know more about that than I do. And it's great that we're having this meeting today and people are really prepared to discuss it. But linked to that is, of course, the behaviour of the chief executive and the managers. And if they don't buy into this, and if the board is not interested, we're now in the NHS. I've been leading some work for the chief executive of the NHS. We are looking to what interventions that may be good practice, because the evidence base, as I say, is not great, should we try and get in every NHS institution. And one of the things that we're putting in, that there will be a non-executive on the board of every NHS institution whose responsibility is to report to the board, just like you report financial matters, their health and well-being of the staff, which means that person will have had to find out about the NHS staff and what's being done in the organisation, and possibly go to the committee in the hospital or organisation in the community where these things are discussed. So there's much about the organisation of work. And I don't know whether any of you have seen this very good report. It came out in 2015 from the OECD, Fit Minds, Fit Work, when they looked at 9 OECD countries, including the United Kingdom. Doesn't make easy reading for us, because they say we're best at policy and ideas. We're not very good at implementation. That is more or less what they said. But what they said was conflict with managers are a main reason for seeking help. So the type of help being sought here was psychological help, such as an IAP services or an employer advisor, and it's difficult managing relationships with managers and supervisors. And this relates obviously to what Paul said about saying the right thing, about acknowledging people, about saying thank you. None of these things cost us a great deal of money. And although I've stressed and want to stress again mental health, remember what I've said about musculoskeletal problems. The cost is enormous, and this is what the figures show us at the moment about the UK. But as I say, back pain is the catch-all for an awful lot of other things that are going on. So what is a good workplace? And this is really when I'm going to try and at least come closer to the things that you're good at and most interested in. Talked about visible leadership, talked about board level or equivalent engagement, and really the good physical environment. It was said that I, for my sins, ran one of the Cambridge colleges. When I arrived there at Newnham, I said, could the domestic bursar, that's the person who looks after all the things going on in the college, show me what we did for the health and well-being of staff. So she brought me this great folder, and we comply so beautifully with HSE. They would be proud. We have everything in that folder that relates to the safety and well-being. I said, no, I really don't mean that. I mean, what do we do to ensure that they get a good physical environment, good food, encourage them to cycle to work? Because, I mean, Cambridge is flat, you could cycle to work. Well, we did nothing. We did absolutely nothing. We're on a journey. But when I did the questionnaire for the staff, I was saying it'd be good if we had a bicycle scheme, perhaps, so you could bicycle to work. Well, what they came back and said, well, where are the showers? If we cycle to work, where do we change? Of course, we had no showers. So, I mean, we did have to spend some money. We did have to put in some showers. They said, could we have a Pilates class? Well, where were we going to do it? Then you have to discuss with all kinds of people. There are all kinds of rules, which space you can use for your Pilates class. But a lot of it was about very practical things. There were some other quite serious things about training of managers. But we have been able to do quite a lot through this physical space and enabling people by the design. And remember, in a Cambridge college, you're often dealing with buildings that are pretty old, and you've got to make quite a lot of adaptation to old buildings, again, a problem. But good physical environment, hugely important. Accountable managers. And remember, when you do these things, you will affect people's mental health. There's no doubt about that. And you really want to empower people to do things for themselves, because that's the way it will be sustainable. And if you haven't seen this, it is a long report, but there's a good executive summary. Please at least look at the executive summary. It took them 2 years to do it. That was again because of the lack of evidence. They had to search pretty hard to really try and come to some sensible conclusions. But the National Institute for Care and Health Excellence looked at the organisation of work and the workplaces. These were their aims, and you will see almost top of their list of the things that all employers and CEOs and senior managers should do is address the issue of the physical workspace, because that will affect other things. They put mental health and well-being at work close by. Really, Paul's been talking a great deal about trust, participation, feeling of justice and fairness, and job design. Training line managers, we appoint people and give them promotion because they're good at their job, and we don't really very often train them to do other things. My next 3 slides were taken from the summary of a report by MITI, but I found some of what they said. I wouldn't normally get access to those reports. Somebody told me about it, but in there they reported from some British Heart Foundation research. So how much of this echoes with you? I suspect quite a bit of it. 52% of us regularly eat lunch at our desks, and no doubt slouch over our desks while we're still looking at our screen and still doing our emails. 31% of us sit so long they even put off going to the loo. When I came in this morning, was going through my slides, we were talking about this, and several people said to me, yes, I do that too. 78% of us feel we sit too long at work, and people are conscious that that impacts on their health in a negative way. And then people say they're less active at work than coming to home. So what can you do to help make this different? How do you come into this agenda? And so should we not build in the need for more mobility around the building rather than this ever great densification. And although it's only a small thing, I certainly have been impressed, and I've seen it most actually in Canberra, in Australia, the use of standing desks, and often those desks you can roll around. And we know that standing up to have a meeting uses more calories than sitting down. And having a standing up meeting certainly makes sure you stick with the agenda and you don't waste a lot of time. This too was in that report, looking at productivity in the workplace. Some of the factors cited for the problems that we face, that working environments are not keeping up with the nature of work, which is changing. We touched on, or Paul touched on, the digitalization and what that means, and the fact that we might be taking old models and then just digitalizing them. So much to think about there. And then again, in this report, I liked what they said about the changing nature of office work, and they had quite a few survey results in there. And they really talked a lot about how the stress, if you like, of more personal accountability, staff measured more and more on outcomes. You can see that's more here, very easy to read, but it's lowest in the private sector, the public sector and the not-for-profit organisations, although I'm very keen to see that change, certainly in the National Health Service. Our product is patient care, patient outcomes. We should really be measuring that very, very carefully and taking it back to the environment, both the physical and the non-physical, which we create. So train your managers. That will add so much to this whole environment. Include training, not only about understanding people's health in a very broad sense in their mental health, but the importance of physical space. And I talked about empowering staff and getting staff to be more active and wanting to be more active. This is taken from a very good NHS organisation in the north of England, one of our best neurological centres, the Walton Centre, and they asked their staff of all the things that the Trust could do and invest in with a limited budget, what was most important to the staff. And it came out that what they said here was they wanted better opportunities to be physically active. They wanted other things. They couldn't have everything. They couldn't have the swimming pool, which was high on the list, but they could do and did do other things. So they tried to focus on the key health issues where staff said they needed help, considerable emphasis on physical activity. Their sickness absence reduced. Of course, I'm not trying to argue that this is necessarily causal, but there may well be an association there. And in my own little world at Newnham, when I asked the staff, that really was rather poignant. They said to me, can we have some bicycles like the students? Can we have proper Cambridge bicycles with the big baskets at the front? And can we have Newnham College down the side? Can we feel proud that we work for a Cambridge college? Students have this, so that at lunchtime we can actually take a bicycle out, if you want, bicycle along by the river, but feel proud to be part of this organisation and feel we have something that the students have. One of our alumni gave us £1,000. We have 4 beautiful Newnham bicycles with the big baskets on the front. They're always in use. You know, another 4 would be wonderful, and but it's great. It mattered. It mattered. We needed to listen, but that was about being able to be a bit like the people they look after day in, day out, and it's made a big difference. A small thing that made a big difference. What is good work? I'm not going to go through this. Of course, there is no time. But I do want to mention one thing. Paul had one thing that he repeats at lectures, and I have one thing because it was such an important lesson to learn, and that is about control. How much control do we feel in our work each day? Some of us are fortunate and we do have more say, others are not. And so mine is really about my train driver. When I first took my job, this is quite a few years ago, I asked if I could go and join people I thought had boring jobs. And I went and joined my train driver at Bakerloo Station and went up and down the Bakerloo line on the early shift at 5 in the morning. I thought it would be a dreadful job. And I kept bothering the poor man and saying, well, could we do the Jubilee line or the Central line? And you know, wouldn't you like the late morning shift or the evening shift? And what about 3 weeks underground, a week above ground? Because then you would see some light and that might be important. He was really fed up with me. Happy to drop me off, dropped me off and said a most important thing to me. He said, look, this is my train. Nothing happens on this train but that I give the instructions. Safety of these people behind is up to me. I like my line. I don't want a different shift and I don't want it to be changed in any way. Got good workmates and good occupational health. So he really taught me the great importance of control, and what you might think is boring depends how well somebody is integrated in the team and how well they're doing. I'm going to end just with this little competition, which you may or may not know about. It's in its 4th year. So hopefully this year there will be more companies taking part, and institutions had 111 companies taking part last year, not many as yet, not many public sector organisations. We're trying to increase that. But it was really just looking at some of the parameters for health in companies and seeking to find the best company. But this echoes what I've said to you earlier. Being obese, not exercising enough, high blood pressure may be associated with obesity, smoking, alcohol, and suboptimal nutrition. Much of this relates to what the British Heart Foundation found, but this is self-reporting from employees in workplaces. So going on from what they found, unrealistic time pressures, minority employees feeling their line manager has received training to support their health and well-being, and interestingly that best companies did have a lower cost of productivity, of lost productivity than the worst performing companies. So it's difficult to give you hard evidence in the space that you are experts in, but I sense it's a really important space. And what it would be really good would be to have more evidence to put into this mix so that we can make an even better case for why the physical environment is important. So I'm going to leave you with that challenge. Thank you very much.
We are a little pushed for time, and I know you have to leave as well. So,
Yeah, I take if anybody.
If there's just any one question, so there's a burning question, and then we'll let Carol lead us.
What's the cause of more sick days in the public? Sorry. What's the cause of more sick days in the public sector?
That's a very good question. I think if I'm being honest, it's not being investigated enough for us to know, but in the sickness absence review that David Frost and I did for the government, we asked that they started to dissect this in a much greater detail than we could. One of the suggestions we made when we looked across the public sector was the lack of chief executive engagement in this health and work. They saw it as really soft and fluffy. You know, try to persuade somebody running a hospital that the health of their staff is more important than the health of the patient. Very, very little managerial training. So it was deeply low down on their agenda. Hadn't got really the very vocal support of the chief executive of the NHS, which has now changed. So there was something around that. We asked, of course, not an easy topic to discuss, we asked the government to take a serious look at the sickness absence policies within the public sector, and to see whether the length of time that one has off if one is a public sector employee, which is often rather different from what's in the private sector, was contributing. And this inability in the public sector to get on top of those two common problems. You know, we ought not to be leaving people with mild mental ill health and mild musculoskeletal problems at home, sick, in inverted commas, without us really trying to understand why. Often they weren't contacted for many, many weeks. So a pattern of being away from work was set in, very difficult to encourage them to go back to work.
Great. Thank you very much.